Thank you, Kelly. See you then. Well, military help is on the ground here in Indiana to help doctors and nurses working with more patients than they've ever seen before. IU Health says it asked for FEMA for support as we see more COVID patients needing care. The U.S. military announced this week that Indiana will get that help.
People don't seem to understand what's going on in hospitals in states like Indiana, and it is absolutely dire.
That's Dr. Gabriel Boslett, who is an IU Health pulmonologist. He was on MSNBC recently saying that hospitals have never seen this many patients and expressed concern that with the Omicron variant, they could be overwhelmed.
It makes my heart race to think about what that could look like. I mean, it could look like people dying because we don't have enough places to put them and them just suffocating alone. It means, putting people, caring for inpatients in ambulance bays, which is happening in one of the hospitals here, in conference rooms, which is what's happening here.
This federal help is in addition to those Indiana National Guard teams who are also providing support in 19 hospitals across the state. In a statement, IU Health says it's, quote, continuing to leverage all available resources to support patient care. Here's what that FEMA help will look like. For the next 30 days, a 20-person clinical team of physicians, nurses, and respiratory professionals will be integrated with teams at IU Health. Well, as new cases and hospitalizations continue to rise, there are more questions about the effectiveness of vaccines. Are hospitals filling up with people who've already been vaccinated? Bob Siegel tackles that question in this morning's 13 News Verify.
Many hospitals are overwhelmed right now, and they say it is in large part due to a spike in patients battling coronavirus. Stacy wants to know, I've heard most COVID patients in the hospital are not vaccinated. Is it true? And Christopher wrote to ask what percentage of COVID patients requiring hospitalization are non-vaccinated. To verify, we turn to 3 Indiana hospital systems. Community Health Network, Eskenazi Hospital, and Ascension St. Vincent are our sources. Let's look at their numbers. Community Health tells us between November 19th and December 19th, it admitted 874 patients to its hospital for COVID-19. Of those patients, 839 were not fully vaccinated. That's 96%. That's also what Eskenazi is seeing. Yesterday, 72 patients were in that hospital because of COVID-19. Eskenazi says 95% of them are not fully vaccinated. And according to the hospital's medical director, that's a big problem.
It feels like a lot of people, Bob. We have over 70 positive COVID patients in the hospital right now. Given that our hospital is completely full, it's really straining the system.
The numbers at Ascension St. Vincent Hospital are similar. Overall, for the entire year, about 93% of patients admitted with COVID were not fully vaccinated. And Ascension says most of those patients had no vaccine at all. But the numbers at Ascension St. Vincent appear to be shifting. Doctors are now seeing more breakthrough cases of patients who need hospital care despite being fully vaccinated.
And it's the minority by far. But we went from numbers of 95%, almost 100% being unvaccinated some months earlier in the year to now it being down around 80%.
This is the chart Ascension sent to verify. You can see the percentage of hospitalized COVID patients who are unvaccinated dropping throughout the summer and fall. Dr. Belcher says that's probably because vaccines are not quite as effective against the virus's new variants, and because vaccine effectiveness diminishes over time for those who don't have a booster shot. He says the downward trend helps explain why people should get a vaccine, not avoid them.
We saved so many lives. So many people have stayed out of the hospital because they were vaccinated fully, and they've done well. The virus is evolving. We need to stay ahead of it. It's not that it's a waste of time. The vaccinated people generally stay out of the hospital. Almost everyone in the hospital, 8 out of 10 at least, are unvaccinated individuals.
So, is it true that most COVID patients in the hospital are not vaccinated? We can verify, yes, it is true. Right now in central Indiana, unvaccinated people make up anywhere from 82 to 96% of COVID patients who are hospitalized. See something you'd like us to verify? Send us an email to verify@WTHR.com.
Starting next month, the federal government will start mailing free at-home COVID test kits to anyone who requests one. The White House is preparing to ship as many as 500 million of these kits. It's also setting up a website where you can request one. But we know a lot of you will need those tests before getting together with family for Christmas. So we have a look at where to find those tests right now. It's on our website at WTHR.com.